more than 104 million infected globally, more than 26 million in US alone, another 10.8 million affected in India. After spending almost a year in lockdown, countries across the globe have finally started getting a handle on how to deal with the virulent coronavirus. With the numbers almost dramatically coming down in India, the question everyone is asking, is it over? The answer to that lies in a combination of a number of factors, and one of the most important is also one of the biggest global events of our times, the vaccination drive for COVID-19. Before we travel the globe, first, let's take a look at figures in India. While India still has the world's second highest number of coronavirus infections, there has been a sharp dip in new cases and deaths in recent weeks. In fact, this week, reported daily new cases sunk to the lowest in 8 months, and deaths fell below 100. The first week of February saw India announce to the world it was the fastest country to inoculate 4 million people with the new COVID-19 vaccination. The country's health ministry claimed the immunization feat was achieved in 18 days. The same week, India reported a continued dip in new cases of COVID-19.
एक्टिव केसेस जैसा मैंने बताया हर दिन घट रहे हैं.
But 4 months ago, as the country of 1.3 billion stepped out of a strict lockdown and got ready to celebrate its annual festive season, the scenario was quite different.
So India's COVID tally has crossed 4 million mark.
Our positive cases continue to grow unabated where COVID-19 is concerned.
Now the jump in India's COVID tally and reaching 4 million cases comes only 13 days after.
Back then, experts warned COVID-19 infections in India might see a sudden spike post the festivities. Mid-September saw the coronavirus caseload increase to almost 100,000 new infections each day. They expected crowded gatherings at Dussehra and Diwali to be super spreader events. But curiously, this is not what happened. Instead, the country's COVID curve bent. India's COVID-19 caseload hit a peak in mid-September and then started declining. Slowly but steadily, the number of new cases dipped. Hospitals reported fewer seriously ill patients, and the country's COVID fatality rate plummeted. While the government claimed policy and enforcement success. Scientists say the numbers are true, but they can't pinpoint at what worked. Health experts and epidemiologists are now probing why India's coronavirus numbers declined dramatically months before any vaccination began. One possible explanation can be herd immunity. A recent serological survey conducted in the capital showed that 56% of Delhi residents already have coronavirus antibodies. The survey, conducted between January 15th and 23rd, is based on 28,000 samples, bringing experts to suggest that more than half of Delhi's 20 million inhabitants may have already been infected with the coronavirus but showed no symptoms.
वैक्सीनेशन की जरूरत अभी भी पड़ेगी. अगर आप मान लो दिल्ली में आधे लोगों को इम्यूनिटी है, तो मान के चलो आधे लोगों को अभी भी नहीं है, तो वो पॉपुलेशन पूरी तरह एक्सपोज्ड है. दूसरा, जो वैक्सीनेशन के बाद जो एंटीबॉडी डेवलप होते हैं, उनका एक वो मेजर्ड अमाउंट में होते हैं. हमें पता होता है कितने डेवलप होंगे, कब तक सस्टेन करेंगे. तो वैक्सीनेशन को अभी और क्रिटिकली परस्यू करना पड़ेगा, और जब तक वैक्सीनेशन की ड्राइव में कोई ढीलापन नहीं छोड़ना है. और इसके अलावा जिन लोगों को इम्यूनिटी डेवलप भी हो गई है, चाहे वैक्सीन से डेवलप हो गई हो, चाहे बीमारी से डेवलप हो गई है, वो आगे बीमारी को फैला तो सकते ही हैं। तो जिनको इम्यूनिटी हो गई उनको भी मास्क का पूरा इस्तेमाल करना है और बाकी सारे प्रिकॉशंस को पूरी तरह से मेंटेन करना है।
The previous 4 sero-surveys conducted in the national capital consistently showed a country inching towards wider prevalence of the COVID-19 antibody amongst its population. Results of the 2020 Mumbai sero-survey found that 57% of Mumbai slum dwellers and 16% of people living in other areas had antibodies, suggesting prior exposure to the virus. Serological surveys estimates the proportion of the population which may have been infected with the novel coronavirus in an area, but they do not show how many people are immune to the virus. It still isn't clear how long antibodies provide immunity. The World Health Organization says at least 60 to 70% of a population needs to have immunity to break the chain of transmission. More than 107 million vaccine doses administered across the world. That's more than the number of people afflicted by the virus. The COVID-19 vaccination drive has picked up pace across the globe. India plans to vaccinate around 300 million by August 2021. But can that target be reached in time?
On 30th January 2020, India recorded its first coronavirus case. A little over a year later, India is undertaking the world's largest vaccination program.
We have so far administered almost 46 lakh doses.
India became the world's fastest country to cross the 4 million mark in just 18 days. The country had administered over 40 lakh vaccine doses by then. The United States took 20 days, while the United Kingdom and Israel both took more than a month to achieve this number. After losing over 1.5 lakh lives to the infectious virus, the country of 1.3 billion began its COVID-19 immunization drive in mid-January. But from here on, it's an uphill task for India. With a large population to vaccinate, India is likely to take a much longer time to inoculate its masses. The target is to vaccinate 300 million Indians by August. But experts calculate the current pace is too slow. They believe at this rate, India would reach that mark only by October 2021. In the first week of February, Uttar Pradesh, Maharashtra and Rajasthan led the charts in terms of vaccine doses administered. But it is Kerala which has the best vaccination rate in the country. Out of every 1,000 in the population, almost 7 people have been administered the vaccine. The state currently also has the highest number of new COVID cases in India. While the vaccination drive continues across India, public health experts have expressed concern over deaths of 11 healthcare and frontline workers following the administration of COVID-19 vaccine. In a letter to Union Health Ministry, prominent experts have demanded a thorough investigation in the deaths. The government, however, maintains there are no deaths officially related to the COVID-19 vaccine.
Total deaths reported till death are 9. In last 24 hours, 1 death is reported, which is 23-year-old male in Odisha, Naupada. Postmortem report is still awaited, and none of these deaths have been causally linked with COVID-19 vaccination so far.
The government has prioritized those at higher risk to receive the vaccine doses first. While healthcare workers received the first dose, the second phase will see police and army personnel receive the jab.
While India's numbers have seen a definite slump, many have questioned whether another wave is around the corner. Can India be cautiously optimistic? Milan Sharma has filed this report.
India has settled into a comfortable wicket in the battle against COVID-19. With the number of daily infections and deaths steadily coming down, the situation in India is looking up. With more than 10.4 million recoveries as 15,853 patients cured in the latest numbers, the national recovery rate is now a very healthy 97.16%. In comparison to the USA, UK, Brazil and Russia, India's cases per million population is amongst the lowest in the world. But is India out of the woods yet? Let's be clear, the war on the virus is far from over. The government's message is, don't let your guard down.
Going ahead, people need to maintain COVID-appropriate behavior. There is no cause for us to lower our guard. And you did refer to a third wave. When did we encounter the second wave? I thought we had one wave and a decline.
Experts say one must not throw caution to the wind. India Today spoke to the top medical experts on what lies ahead for India's COVID-19 situation. And here is what they said. India reporting lowest cases, but third wave ahead.
Just the fact that number of cases have come down, we should not be too elated about it. That will be too early, and therefore there is a guarded optimism, and guarded because we must continue COVID appropriate behavior even now. And simple things like wearing mask cuts down the risk of transmission enormously. Something like 90% risk is cut down by simple wearing a mask.
Can India afford to take its guard down even a little?
We will again reiterate that the three precautions which we were taking, number one is wearing the mask adequately whenever we are going out of the homes. Number two is, doing our hand sanitization with sanitizers. And three is physical distancing of 6 feet. This has to be continued. Along with that, we know that the vaccination process has started in this country. So that has to be continued as well.
How long before India reaches herd immunity?
India has certainly been very fortunate to have a drastic reduction in the number of cases since late October. Though there are many reasons that are attributed, none of the reasons have been scientifically proven. The reasons given are herd immunity because of increased number of asymptomatic infections which were not detected.
I don't think so. It's close to herd immunity because, generally if we need a herd immunity, we need 70 to 80% of the population to get the infection or antibodies. Currently, we don't have that data that, 70 to 80% of infection rates have happened in the country. So I will not say that India is close to herd immunity.
How long before India reaches herd immunity?
Depending upon the R number, the herd immunity could be anywhere between say 60%, 80%, even 90% if the virus is very transmissible. And therefore, we cannot say at this stage whether we are moving closer to herd immunity. There are only two ways that can help us protect us getting towards that. One is of course vaccine. So everyone must, when their turn comes, get vaccinated. And number two, continue to maintain COVID appropriate behavior.
The message is clear. The situation is stable and improving. India is in a solid position, better than most parts of the world. But nothing will justify letting our guard down now. The war against the virus remains on. With Milan Sharma, Nolan Pinto and Saurabh Vakhtania, Bureau Report for India Today.
The novel coronavirus has seen a few mutations. The most virulent form was recently reported from United Kingdom, forcing the country and much of EU to press the panic button and get back into another round of lockdowns. Then there is the South Africa variant that is supposed to be even more virulent. But whichever the variant, effective and safe vaccination seems to be the only weapon humanity can wield. So let's take a measure of the vaccination drives around the world. While India started its vaccination rollout from January 16th, it is yet to register the impact of the drive. Compared to India, the number of vaccine shots given in countries like Israel, UAE, UK and the US are much higher. However, the vaccination drives in these countries had begun earlier as well. Currently, Israel is leading the world in coronavirus vaccinations, with 1 in every 3 Israelis having received at least one shot, a far higher fraction than anywhere else in the world.
Hopefully, I hope that we'll get it through this wave, this immense wave of patients. We'll get it done. We'll be up to the challenge without many deaths. The toll won't be high.
While the country has already provided the first dose of vaccines to a majority of its population, with another fraction receiving the second dose, Israel has now imported a third booster shot to fight the mutated strain.
We're going to see in Israel, I guess, in about a week or 2 weeks' time, a reduce in the hard cases because, as you said, we have huge success in vaccinating our most vulnerable population.
With a population of just 9 million, Israel set itself goals that would seem impossible for countries with larger population figures. The smaller size of the country and its relative economic well-being turned out to be advantageous for Israel.
אני מציב היום יעד לאומי שהוא הבסיס ליציאה שלנו מהקורונה. לחסן לפחות 90% מגילאי ה-50 פלוס תוך שבועיים. זה יעד שהוא בר השגה, משום שכרגע 77% מחוסנים.
While Israel remains at the number 1 spot when it comes to percentage of population vaccinated, the country which has vaccinated the most in sheer numbers is the USA, which by 1st of February had already crossed 30 million doses. And China came second, having crossed 24 million. On February 1st, 2021, Finance Minister Nirmala Sitharaman proposed the Union Budget for the financial year 2021-22. And reeling under the impact of the ongoing pandemic, it was no wonder that the Finance Minister made a remarkable increase in the health sector. And the Health Minister later explained the advantages of having the requisite funding in the year to come.
The pneumococcal vaccine, a made-in-India product, is presently limited to only 5 states. It will be rolled out across the country. This will avert more than 50,000 child deaths annually. Honorable Speaker, I have provided 35,000 crores of rupees for COVID-19 vaccine in this year 21-22. I am committed to provide further funds if required. So the budget outlay for health and well-being is 2,23,846 crores in this BE 21-22 as against the BE of only 94,452 crores, and it marks an increase of 137%. The details of the same are at Annexure 1 of the speech.
6 prominent pillars की बात की वित्त मंत्री ने, उसमें टॉप मोस्ट पिलर हेल्थ एंड वेलबीइंग, और जिसके माध्यम से हमारा स्वास्थ्य के क्षेत्र में जो इन्वेस्टमेंट है वो 137% बढ़ा है, जो कि पिछले साल के हमारे बजट एस्टिमेट से 2.37 times ज़्यादा है.
Now for some vaccine diplomacy news. India, being the biggest manufacturer of vaccines, has not only promised supplies of the COVID-19 vaccine to several neighboring countries, but has started delivery as well. But does India have enough to inoculate its own 1.25 billion strong population?
Weeks after launching world's biggest vaccination program in India, our country has now started supplying COVID-19 vaccines to its neighboring countries as goodwill gesture. India, being the vaccine powerhouse, which makes about 60% of the world's vaccines, pledges to give away free vaccine doses to its neighboring countries in what is being widely described as vaccine diplomacy. Many mid and lower income countries are to secure supplies of the easy-to-store Covishield. India, in just the last few days, has sent consignments of domestically produced coronavirus vaccine under the grant assistance to Bhutan, Nepal, Bangladesh, Myanmar, Mauritius, Sri Lanka, Afghanistan and Seychelles. I'm going to take you through the numbers, the number of doses that's already been given out. 1.5 lakh doses that's gone out to Bhutan, 1 lakh doses that's gone out to Maldives, 1.5 million doses that's gone out to Myanmar, 2 million doses to Bangladesh and 1 million doses to Nepal, while 50,000 doses that's gone out to Seychelles and about 1 lakh doses to Mauritius. Now, after receiving numerous requests to purchase the vaccine, India has now also commenced the commercial supplies of the doses to a number of countries, including Saudi Arabia, South Africa, Brazil and Morocco. India initially will only ship the Oxford AstraZeneca's Covishield vaccine made by Serum Institute. The country only plans to start exporting Bharat Biotech's vaccine on a later stage. Now, one would ask, what about India first? When will the entire Indian population get the vaccine? And are there really enough doses? Is India in a position to fulfill its own demand of COVID vaccine and still distribute to other countries? Well, India is called the pharmacy of the world for a reason. Government says that the vaccine will be distributed and administered to the local population first, and it can increase vaccine production to meet the demand internationally in the meantime.
India's COVID numbers seem to be stable and improving. The global vaccination program is chugging along, but health experts caution India and the world cannot yet afford to let the guard down. So for now, keep sanitizing and put that mask back up.